So as we all know, during the Valsalva maneuver, most of the murmurs they tend to decrease because during the Valsalva maneuver, the intrathoracic pressure increases and thus it decreases the preload. So when the blood flow is decreased through the damaged wall, the murmur obviously will decrease. Opposite happens during the squatting. As the preload is increasing, the flow is increased and the murmur intensity is increased. But there are two exceptions for this, guys. One is HOCM. As you know, in HOCM, the ventricles are already, chambers are narrowed down. So during Valsalva maneuver, as the preload is decreased, what happens is now ventricle walls become more narrower and they rub each other. That's causing the turbulence. That's how the murmur is increased. Opposite happens during squatting. When the preload is increased, the murmur decreases. One more exception is mitral wall prolapse murmur, guys. So what happens during Valsalva maneuvers, as the preload decreases, the systolic click comes later. That's why the murmur is prolonged. And opposite happens during squatting. When the preload is increased, the systolic click comes earlier, so the murmur is shorter.